Good afternoon, everybody. This is just a bit of an impromptu live, and I'm sure that most of you are probably out doing something fun today, because at least here it's a beautiful Saturday afternoon, sunny outside. But I just want to hop on because I shared something on the page earlier today from my buddy Taylor Laviolette, and it's gotten a lot of attention, which I absolutely love, and I just wanted to add to it. So when we look at what he posted up, and it's funny because part of this came from a bit of a group discussion that I was able to monitor. So Taylor posted up and said, patients come in and they say, wow, I feel so much better. I can hardly believe it. It's remarkable. It doesn't hurt when I move anymore. I'm back to doing the things that I like to do, and I feel better on the inside and outside. Thank you so much. But physios like fix stuff. And I think it's time that we start talking about what we can actually do. We've been teaching for the past couple of years, and the one thing that I didn't necessarily believe then, but I 100% believe now, is that us as massage therapists can be the leaders in musculoskeletal care. And we preach about this at our courses on a consistent basis. Because if we actually utilize what's available to us as practitioners and what's in our scope, and I know scope of practice varies, but if we really utilize what we have in our scope, we can make a massive difference in the care of people with pain. So I made a couple notes about it just so that I stay on track. So if we utilize what's available to us, let's look at our scope of practice. Here in British Columbia, our scope of practice is basically the same as it is for physiotherapists, with the exception of using electrical modalities and any kind of needling or something that will pierce the skin. And I, for years, and I'm not saying this as a diss to physiotherapists in any way, shape, or form. I have lots of friends that are physios. But I thought for years that physiotherapists came out of college and had this massive amount of education on movement and exercise. Now, the ones who went to school and maybe did their kinesiology degree and then went on to be a physio probably have that background. But in physiotherapy school, from my friends that are physios in both Canada and the States and around the world, all say that most of what they learned in exercise came after school. So there's absolutely no reason that we can't incorporate movement and exercise into every single one of our treatments. And I'll get into why that's important in a minute. But our scope allows us to do everything that a physiotherapist does. But the one big difference is that we get to spend a lot more time with people. And if we really use that to our benefit, we can make a massive difference in helping people who are dealing with a painful episode or a painful experience, or they're dealing with persistent pain, because we get to spend that extra time with them. They'll talk to us. We get to talk with them. We get to really get involved in what's going on with them and, provide some advice about home care, provide some advice about being able to go home and do certain exercise or movements. And I know that there's some people, perhaps our friends down in the States, that are saying, well, exercise prescription isn't part of my scope. But active range of motion and passive range of motion is part of your scope. So there's absolutely no reason that you can't incorporate exercise into your treatments. And that's very, very important, because when we look at the clinical guidelines of musculoskeletal care, it gives us 4 steps. It says reassurance, education, movement, and some manual therapy are going to give us the best outcomes for treatment. And that also comes back to that time aspect, because you've got that patient on the table, usually for a minimum of 30 minutes, sometimes up to 2 hours. I used to do 2-hour treatments for one person, and I did not like it just because I didn't want to work that much for 2 hours. But at any rate, typically our treatments are anywhere from 30 minutes to an hour. That's a lot of time to be able to spend with somebody. And while they're talking on the table, that's a whole lot of time that you can spend reassuring them that they're going to be okay, that we can look at red flags. We can look at other things that are going on with them and say, you know, explaining to them that pain doesn't correlate with tissue damage, that, you know, maybe they're just having a painful experience, but there's no tissue damage, or that they've had some tissue damage in the past and it's healed. And there's a whole bunch of different things that we can do to provide reassurance to them that they're going to be okay. And in part with that, we're going to provide education as to why they're going to be okay. And then we can get them moving, and we can do some massage. So we've got this huge window where we can do so much with people. And if you can take that person and validate the fact that they're having a painful experience, that's probably going to go a lot farther than what they're getting in traditional other care. So who better to provide those 4 clinical guidelines of musculoskeletal care than us? We've got the time, we've got the ability, we've got the know-how to be able to do all that stuff. So another thing that I've been hearing about is that some people are working in clinics where a clinic is trying to define what their scope is. Don't let that happen, because to be honest, most interdisciplinary or multidisciplinary clinics probably have an idea in their head that they want a certain practitioner doing this and a certain practitioner doing this, but most of them don't actually understand what our scope of practice as massage therapists are. So if you can really nail down and have a very comprehensive and good knowledge about what your scope is, wherever it is that you may live, don't let those people try to define what you can and cannot do in a treatment. Because the better that you know that, the better you can provide those 4 principles of care. So don't let those people define it. Show it to them, explain to them what you can do. You know, within Canada, we've got an interjurisdictional competency report that I think most people can probably get access to online, that talks about what our scope is as massage therapists. And I think it's mostly to the regulated provinces, but if you can get that and sit and look at somebody in your clinics who's trying to define what you can and cannot do, then by all means, get a hold of that and say, actually, I'm well within my scope to do this. I'm well within my scope to do this. Because if you're a contractor in a clinic, they can't really define what you're allowed to do in your treatment. It might be different if you're an employee. I don't know enough about that to say that, what the rules are around that. But if you're a contractor, come in and just say, this is my scope, and these are the things, these are the parameters that I'm going to work within. But the more that we can implement those 4 things, reassurance, education, movement, and some manual therapy, we as a profession can be the leaders in musculoskeletal care. And I truly, truly believe that. And I want all of us to step up and be those leaders. So just want to jump on and talk about that a little bit today after sharing Taylor's thing this morning. So please, let's join together and let's step up to be the leaders in musculoskeletal care. All right, enjoy the rest of the day.